Dr. Kevin Cavanaugh. He's a retired physician and founder of an organization called Health Watch USA. Good morning to you, sir.
Good morning, Jack.
All right, let's talk about the latest. You just sent me some information about the N95 mask shortage.
Yes, that is still going on, and it was an AP report. They're missing a critical component of the mask called melt-blown textile. Apparently that's made from plastic through a special process. And the healthcare providers are still having trouble getting the N95 masks. And this is kind of disturbing because we've talked before, we really need these for other frontline workers, everything from people who are distributing groceries to teachers at schools. So this is of utmost importance to get this right. And Jack, this comes on the heels of course, the Bob Woodward President Trump tape where it was known that this was spread through the air back in early February. And so this is something I really think we needed to get up and running, maybe invoking the Defense Production Act. But we need to, at this point, at least have enough personal protective gear for our workers so that they're as protected as they can be.
And a lot of this gear, maybe all of it, comes from outside the United States, does it not?
Well, some of it does, but by this time we should be manufacturing it within the United States. That's key, because if it's made outside the United States, even with an American company making it, it may be difficult to get it into our country as opposed to having it distributed and used by the country it's manufactured in.
I understand that COVID-19 they've decided, is more of a heart than a pulmonary virus. Could you talk about that?
Well, I think a lot of people are starting to think that, and I'm one of those. If you look at the symptoms of COVID-19, early on, people were saying, let's buy pulse oximeters, because the first thing that happens is your blood oxygen drops. Well, that makes no sense. I mean, if it's a primary pulmonary virus, you should be short of breath far sooner than your blood oxygen drops. And new research has come out that has indicated that that may be due to vasodilatation in your lungs, similar to what happens with the hepatopulmonary syndrome, and that the blood just kind of runs by your lungs so fast it can't pick up the oxygen. There have been other studies which have shown that the virus directly infects the heart. In other words, it's not a secondary problem from a thromboembolism or hypocoagulability of the blood that takes place. It can directly infect the heart. And then finally, and this is what I find even more concerning, are the reports we're seeing now of myocarditis. And that's of a viral inflammation of the heart. And many times, myocarditis does not have any symptoms. Dilated cardiac myopathy, which can be the long-term result of this, sometimes just appears. People don't know what causes it. In fact, about half of the cases are what's called idiopathic. They don't know the cause. And they're thought to be due to viral infections that have occurred in the past that people never knew they had. At least that's one of the more common etiologies that they think is taking place. And if you combine that with the reports of the athletes out of Penn State, where 15% of asymptomatic athletes that had positive COVID-19 tests, that they were positive for myocarditis. And this is very concerning, especially if you're an athlete where you have to be in top shape. Now, we don't know what the long-term effects of that are, but this is something that's very concerning, and it's the reason why Penn State and the Big Ten and Pac-12 have put off their football season till they can get this sorted out. So this is a virus that we really need to take very seriously.
All right, I got a text on our Auto Tech Service text line from Scott who says, looks like Bob Woodward's book has created a panic on masks. He should have held accountable for releasing this book so close to the critical fall season. Millions of unhealthy people will die now because of Bob Woodward's book. What's your reaction?
Well, I'll be honest with you, Jack. When he was interviewing President Trump gave the reason that he was withholding this information because he didn't want to cause panic. There was a shortage of masks. Now, whether or not you accept that reason, I mean, I do. I accept the person's word. But Bob Woodward, I can't figure it out. If he knew this back in February, should have alerted the public. I think as a journalist, you would have that obligation. Just before the election, granted, that's not good. It looks political, but this should have been released back in February. Because let's not forget that on February 29th, the Surgeon General is stating, seriously, people stop buying masks. They're not effective in preventing the general public from catching the coronavirus.
Yeah.
And, there's not much excuse to this.
Yeah, Laura, good morning.
Good morning. Hi, Doctor. Listen, with the chance of making an enemy, and Doctor, I really respect you and everything, and I am over 72, but I have a question on the vaccine triage for who gets it first. They're talking about all these heart problems and things like that. Should we not be vaccinating the children first? And another question on the vaccine, when they give it out, does it have to do with the person's age, how much they get? I mean, I'm over 70, so most vaccines, they say, get a double dose for an old person. And if you have to take 2 doses, and then if I weigh 155 pounds, I mean, how many little kids could be vaccinated?
Hey, I'll let you listen.
It would go a whole lot further.
I'll let you listen off the air, Laura. What do you say, Doc? And then we're going to take a break.
Yeah, I agree with you. I mean, these are very difficult questions that ethics committees are going to have to consider. But remember, as we get more and more information regarding the safety of these vaccines and the lethality and problems of this virus in younger individuals, we're going to make probably different decisions. And so we have to put off until we get the full amount of information, have ethics committees, and then prioritize who gets the vaccine first. And so that will be a very, very big topic. And that's one I'm not an expert in. I'm more apt to listen than to tell you what to do.
And here's another text from our Auto Tech Service text line, Doc. Dr. Fauci, this is from Jim. Dr. Fauci said in an interview yesterday concerning Bob Woodward's book that President Trump never said anything publicly contrary to what they discussed privately in their meetings. There was no contradiction. Do you have an opinion on that?
Well, I haven't gone through all the transcripts, but I can tell you we've been beat to death on this radio show on how this virus isn't very dangerous and just like the flu and not causing many deaths. So I think that people may have interpreted the messaging differently than what Dr. Fauci did.
Yeah. Yeah, we have. We have been beat to death, and everybody assumes that you're against the president and all this stuff. And I know you. I know you're pretty apolitical, but you do, being a doctor, go with the science, which makes sense to me.
Well, in 2 months, when this election's over, I'm going to be so thankful because that part will be gone, but yet we can then concentrate on the virus and maybe getting it under control without all of this politics. And believe me, it's both sides. Bob Woodward, I don't think you would be apt to say that he's a lifelong Fox News conservative, but yet this delay in release of the book really, I don't think was very wise. Should have been done much sooner.
Yes, I agree. And it was the time that it is likely going to sell the most books, don't you think?
Yes.
Yeah. All right, let's talk about the flu and the importance of getting a flu vaccine.
Well, yes, and it is very important because if you get the flu plus COVID at the same time, you're going to be very, very sick. And just for example, steroids are very much indicated in COVID. It causes a significant decrease in fatalities, but in the flu, they're contraindicated. So you will be in big trouble. Not only that, but if we have a lot of people getting flu and a lot of people getting COVID, the healthcare system is going to get overrun. And again, mortality is going to go up and go through the roof. The good news is that if you wear a mask and you socially distance, it should literally decimate the flu pandemic because it is not as infectious as COVID-19. But of course, in the United States, that's going to be a big ask. I doubt that we're going to have the majority of people doing that, especially in Kentucky. So get a flu vaccine. That's going to be key, and you want to make sure you do not have symptoms of COVID or be an asymptomatic carrier when you get it. You want to be as healthy as you can when you get that vaccine.
Now, because we're urging people to get the vaccine in September, will it be good through flu season, or will we have to get a second one?
Well, I think we'll have to wait and see. I'm sure that we'll get further advisements on the health department with that. Early September is a little bit soon to get the flu vaccine, so there's a possibility it may run out later on. It all depends upon the vaccine. And as I said, we will probably get advisement sometime in November, December if it looks like immunity is dropping in the vaccinated population.
So we got 2 minutes left. I'm just going to give it to you. I know you like to talk about specific things. The floor is yours, sir.
Well, I think one of the things that we really need to realize from this week's information is that this is a serious problem. It's been known for a long time that this virus is much more deadlier than the flu. It affects young people. We're not only worried about fatalities, but we're also worried about long-term disabilities. I'm saying worried because we don't know for sure. This virus has been around only a short period of time. We can't tell you for sure what's going to happen. But everybody that's been listening to this show for the last 6 months knows as time has progressed, the more and more we've learned about this virus, the more and more we've realized we need to respect it, we need to be careful. And simple public health measures of wearing a mask, staying at least 6 feet apart, these can stop the pandemic, and it certainly can snuff out the flu. And if you're within 6 feet of someone, you have to wear a mask. If you're further than 6 feet from someone, you still should wear a mask. And this is because sometimes this virus can aerosolize and spread further than 6 feet. But definitely do both. And so let's take this virus seriously. Let's look out for the other people in our community and join together as a group of citizens and quit arguing and bickering about this virus. It is serious, and it's something I think we can all unite and defeat. We just need to follow our public health leaders' advice.
Dr. Kevin Kavanaugh, I hope you have a great weekend. We'll talk to you on Monday.
Thank you, Jack.